Welcome to TCNtalks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Como.
Hello and welcome to TCN Talks. I'm excited today. Our guest is Laura Katz Olson. She's a professor of political science at Lehigh University. Laura, welcome. It's so good to have you.
Oh, it's my pleasure to be here.
Yeah, I was just saying, so Laura, I want you to tell the audience what they need to know about you, but I just want to first say this book is incredible. So Laura wrote this book, Ethically Challenged. Good friend of mine, Kent Anderson at Ohio's Hospice, we were at a conference together. He goes, you got to read this book. I literally, before we got up from the table, had it ordered on Amazon. I got home, I think, on a Thursday, and I picked it up on the Friday night. And by Saturday afternoon, and this is a thick book, I had this book finished. And Laura,
with thick arguments,
a lot of thick arguments. But thank you for writing this, and we're going to jump into this in just a second. But what would be good for our audience to know about you, Laura?
Well, I teach at Lehigh University, and I just celebrated my 50th year there. Which is pretty exciting. I have spent my entire career studying aging, elder care, nursing homes, and things like that. But then I started seeing things rise, little kind of hidden things about private equity. And I said, I wonder what that is. And one day I said, I really need to look and see what is this private equity that keeps popping up for healthcare, aging, and all of this. And what I discovered is that private equity has what they call a penchant for privacy. It's like this curtain over them that nobody can know very much about them. And that, of course, given my personality, that intrigued me even more. Okay, let's see if I can find out what's going on there. And what I discovered is that private equity doesn't have to report to the SEC. And the little that they do have to report is not public knowledge. So you get, big companies, if you get, let's say, a big hospice company, they have to report everything to the SEC. Private equity doesn't. I also interviewed a lot of people who sold their practices to private equity. And what I discovered is that they have to sign non-disparaging clauses, non-compete clauses. So that also keeps what's going on very private. Many of them, I shouldn't say many, nearly all of them refused to talk to me. But the few that did were very cautious in terms of what they said. So private equity is really hidden behind these black curtains. And I was able to not go into it not find out everything. But I was able to find out much more through the use of pitch book data, which is extraordinarily expensive. And I had to beg, steal, and borrow from my university to get the money to buy it. And they gave me a discount because I was a professor, but it was still extraordinarily expensive. And what I mean is that the average person can't go delve into some of this stuff. And then there's another source of data. I think it's called Periki, or I'm sorry, I forget the name. And I just found out that private equity bought them. So that's kind of interesting.
Well, let me back up just for a second, Laura, because you were really taking it to the heart already. There's so many reasons why this book was incredible. And so first off, I've got about 30 years now, and I call it the hospice movement, really try to stay away from the word industry because this is sacred work that we do. When I got in the mid-90s, it was about 30% for-profit, 70% nonprofit. And I've worked in nonprofit all of those almost 30 years now. Now here we find ourselves in 2024, and it is completely flip-flopped. And so seeing that phenomenon, but not really knowing like why is that occurring? Like at a macro level, the way I've described it to people, my godfather is a dear, sweet person, but he's been a serial entrepreneurial, and we went to dinner. I hadn't seen him forever in Austin, and catching up and telling him what I do now. And he sat there and he's like, "There's a lot of people dying. And that's a great business." And I'm thinking, no, that's exactly what's wrong, is that they just do the entrepreneurial calculation. And so, but then seeing this, how you just unpack, especially your first 3 chapters of your book, the introduction, chapter 1, chapter 2, this is the title, Who Even Are They? Private Equity from Soup to Nuts, and then the emergence of the alternative asset class. I really felt like it was a master class. I feel like this is what I was looking for. And so, whatever it's okay, I'll take my attempt of what I think I read, and then if you can take it from there. But here's my interpretation. And by the way, I'm a history nut. I love how you went back through history, because I remember when Michael Milken and leverage buyouts and junk bonds. And so the idea of a leverage buyout, which is, okay, I get capital. I'm going to buy this company, but then I'm going to load that company with debt. Then, very smartly, I start paying myself via management fees and then dividends. So let's say, I'll make simple numbers. I took $100,000 of capital. I purchased the business for $100,000, which won't happen, but just for sake of simplicity. But then I get all of it back via management fee and dividends. I now got my money back. And then if I do that 2 or 3 times, stitch those companies together, and then use very aggressive, almost unethical sales practices to jack up the revenue, and then maybe even flip the company. Now I made a profit from it. And that's my interpretation, or at least simplistically, of like generally their playbook. And then you're also alluding to the fact that they are able to kind of do this beyond a veil of secrecy. Can you take it from there and probably explain it much better than I just did?
Well, let's start with the fact that, and I think this is one of the most important issues in private equity, they do not care what they're investing in. It could be hospice or it could be Roto-Rooter. I mean, they just don't care. So they're really looking for an industry, and you don't want to call it an industry, but it has become an industry, hospice. Yes. They're looking for an industry that's going to bring back a lot of money. And the retail industries, the Toys R Us, which they, of course, went bankrupt under private equity, those opportunities are far less. So they've turned to healthcare as a way that they can bring in what I would call, not me, but everyone calls outsized profits. And as the book says, if they don't get outsized profits, they're going to lose all of their investors, because the investors will go to a place that's less risky if they're not getting outside profits. And outside just being like what, beating the market by some big factor, Laura? Well, right now they're having a problem beating the market, but they need to beat the market commensurate with the risk that their investors are taking. Okay, that's a key point. So they have to... The second, I think, most important part, and how it relates to hospice as well, but it's for healthcare in general, is they really don't care about the long-term growth of the company. And that's because the playbook, in the private equity playbook, they must sell the company within 6 years. So they have to really flip it. Unfortunately for them, they're having trouble in this high valuation, high interest rate market selling. So they're kind of stuck. They sell to, let me just go back. They also get most of their money, not all, but most of the money from state and local pension funds. So, that's where their investment cash comes from? Most of it. Another, I think, key point is that the private equity only puts in, they buy all of their companies through leveraged buyouts, which means debt. The private equity company themselves And this is the beauty of it. They only put in 2%, sometimes 3%, but mostly 2% of the buying price. Their investors, the private equity, the state and local pension funds, they put in about 40%. Mm-hmm. And the rest of it is debt. And of course, the most key to the private equity playbook is that the debt is put on the company themselves. Mm-hmm. So in the case of hospice, they now have a huge debt that they never had before.
And they've got to service that debt and still service the business.
So right, they have to service that debt and they have to service the business. And of course, the trick is that private equity needs to sell quickly. And right now, for example, one of the places they can sell is to produce an IPO. There are very few IPOs right now. Mm-hmm. A second thing that they can do is sell to another private company or a division of a private company. But more importantly, what they're doing today is selling to themselves.
What does that mean?
They're selling, one private equity company buys a hospice, for example, and then within that 6-year period will sell to another private equity company in a secondary LBO, leveraged buyout, which means more debt, of course. Then they'll sell to yet another private equity. When I wrote the book, they were mostly in their first buyout. Many were in their second buyout. Since 2022, since I wrote the book, some of them are in their third buyout. Wow. And right now they're having such trouble selling their healthcare entities that they're very ingenious with their, what they do. Mm-hmm. They put together what is called continuation funds.
What does that mean?
And that means they have another fund, they put another fund, and they take the old company and put it in the new continuation fund, which means that the private equity company gains on both ends of the deal, the selling and the buying. But I've been reading that the pension fund, the limited partners, are getting really angry about that.
Oh, wow. I was going to ask you about that. Because obviously, on one hand, anyone, if you've got your 403B, your 401k, you want it to appreciate in value. So these pension funds, they just want those funds to grow, to be able to, these state employees or whomever. So are they getting more of a clue of where those funds are being invested?
Because of the, as I said earlier, the secrecy of the private equity, it's really unclear where the money is invested, and they don't really tell. The people who control the pension funds, I guess, could find out, but it's very challenging to find out.
Well, and just think of how challenging you were where you started the conversation. Well, one thing I just want to add in real quick, Laura, because part of the aha for me, and I don't know if it's this thing, misery loves company, but I had no clue that what we were seeing in hospice was also happening with autism spectrum disorders, air ambulance, dentistry. Of course, I did know about the primary care practices being purchased, substance abuse. I was just clueless about these other fields. How did you do your detective work, and are there other fields that you're seeing that they're going to as well?
Well, as I was studying, I'm not a finance major, and this was all very new for me. It took me, nearly a year just to understand the finances of private equity. So as I'm looking at these financial shenanigans, or what they call financial, I forget the word now, but playing around with the money and how they do these issues, things kept cropping up, like opium centers and autism. So then I just started studying each one of those as they came up. I did not study nursing homes because it's much more complicated.
And just maybe let's chase that rabbit for a second. And when you and I were doing show prep, so you're writing a new book about nursing homes. You want to just say just a little bit about that?
Well, I've studied nursing homes my whole career. And the one thing about nursing homes that makes it much more complicated is that a lot of the bad stuff, the low quality care, is regardless of whether they have private equity or not. And it's a much more complicated issue because private equity has made it worse. And on top of everything else, and this is true of a lot of places, private equity doesn't get its money from the operations of a nursing home. Mm-hmm. It gets its money mostly by selling the land, the real estate under the nursing homes. Yep. So the nursing homes are very complicated. You can't really sell the land under a hospice.
Right. Yeah. So it makes it much different. Well, we'll be looking for that book when it comes out. One of the things that occurred to me, Laura, so I don't care if you were running an ice cream stand, a hospice, or a dentist office. The general expectation to serve the customer is to provide a good quality product, to do it with good service. There's a timeliness element. None of us like to wait for whatever it is we want to get. That's why Amazon has built a business model. There's a cost equation. So people want to always working to get a good value. So you have cost. So if you actually wrote an equation, it's service quality plus timeliness divided by cost equals value. And what occurs to me when I was reading the book is that they're not working on that. It's almost like trying to create a vending machine for cash, and they're not working on the real problem, and when you start talking about caring for the dying or primary care practice or hospitals for that matter, or air ambulance, that to me is that's the part that's wrong. I don't know if you want to comment on that.
Well, I think it's more than wrong. If you look at, as I started this discussion, if you go under the premise that the sole goal of a private equity firm is to make outside profits, they don't care if it's people dying, or they don't care if it's autistic children. They just go where the money is, like Willie Sutton. You have to be of a certain age to know who Willie Sutton is, of course. When he was asked why he robbed banks, he said, well, that's because that's where the money is. And that's how private equity works. And second, as I said earlier, they are not there for the long term.
Right.
If you're there for the long term, then your equation would work because they care about the quality of services and people won't come back. But they're not there for the long term. And in healthcare, until recently, they've been dumping their purchases in 3 years.
Yeah, that's such a key point. So I'm the CEO of a network of just nonprofit hospice and palliative care programs, and we had a good discussion early on, because sometimes as nonprofits we kind of wrap ourselves in this cloak of holiness and say for-profit bad, us nonprofit good. But what does that mean? We need to unpack that. What makes us? Why do we think we have maybe a better opportunity to serve the patient and family? And one of the things we struck upon is we said we don't have a shareholder. And if you have a shareholder, there's some exit that is contemplated. As a nonprofit, your contract is with the community, and there is no contemplation that you should ever break that contract, which means we are here for the long term to make good decisions and serve patients and families today, tomorrow, and the next day. I don't know if you want to make a comment to that, but that's something we struck upon. Instead of just, almost having an arrogance, well, we're better as nonprofit. In fact, if anything, we have a larger responsibility because of that kind of social contract as a nonprofit.
And I think you're absolutely right, but I think there's more to it. I think people like you go into hospice or into autism services because they really care about the dying patient, or they care about the autistic child. Now, they have to make a profit. Even nonprofits make a profit. Yep. You can't go into it and lose money or you'll just close down.
Yep.
So there's a lot of balancing to do. But the ultimate goal is to provide quality services. And this is not even close to a playbook. They really do not care. And I say this absolutely about the quality of their services. It's just not even an issue.
I love in the book that, so my godfather I alluded to worked for Nabisco. And so I'm forgetting the book, The Barbarians of the Gate. And you cited that book as that whole kind of corporate raider mentality, which was exactly what you're poking on. It wasn't really about trying to make the business better. And you really kind of wove that well into the book. I don't know if you want to speak to that. It's almost like what is old is new. It's just a different version of that icky thing that was cataloged in that book, The Barbarians at the Gate.
Yeah. But if you think about it, one of the consequences of putting this incredible debt on businesses, giving themselves capital, giving themselves dividends whenever they feel like it, underselling the real estate on which something sits. One of the consequences of that is bankruptcy.
Yeah.
And there have been multiple Bumblebee Tuner, I don't know if you know that, David's Bridal. I mean, I can go through a list of many retails that went under because of the playbook of private equity. The question is, can we afford to do this in healthcare?
Yeah, it's almost
my
like...
daughter was very unhappy when we lost, the Toys R Us. But what happens when a cancer patient loses their cancer therapy or
their hospital or...
Yeah, that we can't afford to do this. And when I wrote the book, I predicted, and this is not to, give myself a halo, but because of the playbook, I predicted that there would be a lot of bankruptcies in healthcare. Mm. And indeed, there weren't at the time because they were so new. They didn't really go full force into healthcare, I would say 2015, 2016, which didn't give them enough time to have all these bankruptcies. There was some. Mm-hmm. What was the, I forget now, where the healthcare, one of the early healthcare bankruptcies. But now you're seeing bankruptcy after bankruptcy of cancer institutes, of radiology, of the most famous one, of course, right now is Stewart Healthcare.
I was going to cite, yeah.
But that's just one of many. Prospect Hospital in Philadelphia went under, mostly because they sold the real estate. And when you sell the real estate, the hospital then has to pay very expensive rent.
Yeah.
On top of the dividends and on top of everything. And the question is, can we afford to do this in healthcare? And for me, it's a resounding no.
Yeah, I agree. Laura, I would like to take it too, because we really could just keep unpacking this. What can we do? Like, as our listeners, I mean, it almost rises like an anger, but being angry is not a good thing. And so what can we do? What do you think we can do?
Well, there's a lot of things we can do. I mean, I will say something now that is pretty outrageous, but I would outlaw private equity in healthcare, period.
In total.
But barring that, which is not going to happen,
right?
You have some congressmen now, women, men, who are putting out various laws. One of my favorite people is the head of the Federal Trade Commission.
Mm-hmm. While you're looking for that, Laura, one of the books I did some research this summer because I was starting to think about the foundation, right? So how is healthcare structured in America? Have you ever bumped into T.R. Reid's book, The Healing of America? And he went and researched every healthcare system in the world. And then he kind of stratified them in terms of like the very best. And like, because it's so intellectually lazy, the healthcare debate, because you got to almost go down in healthcare of how it's structured to its funding. And then how do you kind of fix, because if you don't fix that, because if you do fix that, maybe there is a way then to say, well, maybe only private equity in the emerging R&D space, which is more the future, but the current that's been defined like hospitals, hospices, maybe there shouldn't be any private equity there. I don't know if you have any thoughts or if you know about that book.
No, I don't. But I would say that there are some efforts now to not allow non-compete clauses. Mm-hmm. There's some effort now, by various congressmen to cut down on what's allowed. Like, for example, one of the problems you get is that the money that private equity gets from selling their company mm-hmm. Is taxed at the corporate rate, not the individual rate. So, this excites them, and there's been an attempt to cut back on that. Not so much to keep them from making as much money, but to make private equity not as profitable, and therefore maybe people will pull out. There's been, like Elizabeth Warren has put out two pieces of very comprehensive legislation, but of course it doesn't go anywhere.
Yeah.
And by the way, I won't go into this, but I would argue, just from what I've studied, that the reason it doesn't go anywhere is because congressmen make money, have a stake in private equity.
So it's very hard to vote against your own
There's
interest.
a revolving door. Some of them, when they leave, they get hired at very, very high salaries. That there's been shown to be serious interlinking between Democrats and Republicans. This is not a partisan thing, actually.
When you look at your crystal ball, where do you see this going? Like, what do you see happening over the next 5 to 7 years? Is it going to be more bankruptcies? Which kind of your prediction there?
I think there's going to be more and more purchases. If you want to look at hospice, for example, hospice is extremely hot, and they're going to be buying up the nonprofits as fast as they can for a lot of reasons. Home health care is also hot, not as hot as hospice, because Medicare is pulling back on
home health. Yeah, they're much more highly regulated. They've cut the rates more on the home health side.
There's a lot of money being put into IT, healthcare IT. Mm-hmm. But if you look, beyond healthcare, which I kind of look beyond healthcare, there's a lot of money. Money's being put into student loans. They're buying out the student loan industry. They're buying out as much as they can sports,
like
football,
sports teams,
basketball.
Sports teams, you mean?
Yeah.
Wow.
There's a limit to how much they could buy because the sports teams have put limits, but they're doing as much as they can. They're buying out the data, as I said to you earlier. They're buying out the data for private equity. They're just everywhere, and as I said, they go where the money is.
Wow.
So they are definitely going to go into healthcare. Opioids is a big one. They're really going full force on opioid treatment centers. So wherever there's outsized possibility for money, that's where they're going to go. And one of the more important things, I wrote down the exact amount. They have $2.59 trillion right now.
In private equity?
In what they call cash that they have to put somewhere.
Oh, wow.
They call it dry powder.
Gotcha. Yeah, it's on the sidelines and they want to put it to work. Wow.
So if you have $2.59 billion that have to be put to work, they're going to keep buying things.
Now, you said was it trillion or was it billion?
I'm sorry, trillion. $2.59 trillion. that has been promised. Dry powder is money that has been promised to them if they buy something.
Right. Wow.
And so, with hospice, for example, I think hospice is they make something like a 20% profit on hospice.
Yeah, that's part of the problem is typical nonprofit makes 2% and then typically 18 to 20% on the for-profit side. And the argument is, well, obviously we're superior at running the business. Well, 70% of the costs are people costs because those are the people you're putting by the bedside. Yes, that doesn't mean that that's always the case, but the sophistication of the care we're providing, that should be a level playing field. The difference is as a nonprofit, you don't have to pay a shareholder, so you should be able to plow it back into the mission. So investing in your people to provide high quality of care. And so, it's pretty icky. Well, or final thoughts for our listeners, because I want to be respectful of your time.
Oh, I think that people have to really understand that the playbook of private equity inevitably has to undercut the quality of care. It has to. So whenever you put rules and regulations, for example, you must have an RN in hospice care. Whenever you put something like that, they're going to cut back on something else, or else just get out of the business of a particular niche. Mm-hmm. But because they have to make oversized profits, inevitably, unless they're magicians, and I've seen this, you have to. It's going to affect quality of care. And any argument that I have heard in favor of private equity, and I'll just give you one argument, is that they put in agencies that there's a need for more agencies, more need for, let's say, hospice care, or there's more need for autism centers. And yes, they do. They put in de novo agencies, and there is more availability. But the question is, the availability of these centers is so low quality that it's detrimental to the patients. So are you really looking for more agencies that have low quality care? And I think people should think about that if they have a need.
Yeah, that's a great counter argument, Laura. We need more car dealerships, but if they're selling, I don't know if you remember Yugos, they're selling Yugos that break down and leave on the side of the road. That's not a very good argument. Well, Laura, I want to thank you because, again, you had to do a ton of research. This was not an easy lift, but cataloging it and pulling the veil back on this playbook, I felt like it put words to, I know many of my peers in this hospice movement, we were sensing it, but we couldn't put word, like, what exactly is happening here? And I think you really did kind of pull the veil back. And so I just want to thank you, and definitely will be looking for your book on nursing homes. When do you think that book will be out?
Oh, this is in the early stages.
So probably 25, maybe 26, somewhere in that ballpark?
More like 27.
27. Okay, that's fair. Because how many years of research did Ethically Challenge? How many years of research? I guess that's unfair.
I would say on and steady, not on and off, but steady 5 years.
Wow, that's incredible. Well, again, Ed, thank you for the work that you do. And I just want to thank our listeners. We always leave with a thought-provoking quote. And I asked Laura, and so there are a couple I ran by her, and she said she left it up to me. Found one by Albert Einstein, and his word was unrestrained capitalism. And I'll just say, icky capitalism, however words but bad capitalism produces great disparities in wealth, cycles of boom and depression, and festering levels of unemployment. And again, this is Albert Einstein, wrote this years ago. That type of system encourages selfishness instead of cooperation in acquiring wealth rather than serving others. And to me, this is the punchline. People were educated for careers rather than a love for the work and the creativity of the work. And I know the people that I love and do this work in hospice, that's our common ground, is that love for the actual work. And I think that's really what Laura's calling out is it's a playbook that's not actually about that. It's just literally trying to create a vending machine of cash. And then this final quote, this is from Margaret Mead. Never believe a few caring people cannot change the world. for indeed that's all who ever have. Thanks for listening to TCN Talks.